I wanted to be a nurse because of the endless amount of possibilities. We get to be on the front lines as well as be with our patients at their most vulnerable moment. It's just amazing. My name is Audrianna Haynes. I work at Houston Methodist. I've been here for 2 years and I am an orthopedic nurse. I'm originally from Montgomery, Alabama. I got into nursing shortly after joining the military. I had already completed my 6-year term in the military, so I was no longer in the military when I moved here. My military experience has made me a better nurse. Number one, it just taught me teamwork, most importantly, as well as organization, which I think are the main two things in being a nurse. I love being on the orthopedic unit because I feel like it just keeps you going. When the patients come in after surgery, they're up and they're moving and they're motivated to go home. So that's the part that I enjoy. They're ready and they're motivated. March, do you have a patient for me? First thing I do when I come in is I print out my sheets for my patients, determine who I have for that day. And then I also go into the chart and look at some of the recent labs as well as the recent orders that were placed. And I also look at the plan for the patient who's gonna be a part of my care team for today. And then we go in the room and then we take a report for each patient and determine what is the plan for today for the patient. To ensure that the safety of the patients, at the beginning of the shift, we do have a huddle where the charge nurse does go over which patients are at increased risk for falls, which patient has possibly had a fall, which one of our confused patients, or which one of our patients just need that extra help when they are getting up. So even if they aren't your patient, you can keep an extra eye on them. For some swelling in her right shoulder. So what's coming up is at 8:30, we start our morning rounds. We go around with the care team, the social worker, case management, as well as our manager, and we discuss with the patient what's their plan for today, what's holding up their discharge, if there is anything holding up their discharge. A lot of our patients, when they come from surgery, they are in a lot of pain. So we have to make sure that we stay ahead of their pain. A lot of them are very anxious because of the pain. Our patient needs to be medicated for pain before they get up and start moving around with physical therapists.
In terms of physical therapy, why we are important on this floor is because typically patients, whenever they are admitted into the hospital, we are usually the first ones to help those patients move. Whenever we get them up, there might be certain things that we need to review with them, certain precautions, weight-bearing status, looking at different types of assistive devices, meaning canes, walkers, platform walkers, any type of equipment to make sure that the patient has it on correctly and that they are using it correctly. And then spending a good amount of time going over any education with both nursing staff and the patient's family, because typically they're going home with somebody who needs to know how to use the equipment, how to put on a shoulder sling, and just things to look out for at home to make sure that they're in good hands.
I feel like in order for the day to go by smoother, you just have to communicate. That's with the doctors, your other nurses, managers, the PCAs, physical therapy, occupational, speech, down to food services. We all play an important role with the patient. So communication is definitely key to just make things, it makes things run a whole lot smoother. I feel like you have to have the muscle for this job. You're doing a lot of getting patients up, sliding them up in the bed, getting them up to walk. So as an orthopedic nurse, I feel like you just have to have the physical and mental strength just to get through the day. Ms. Hoffman, good news, honey. I have your discharge paperwork.
Let's do it, baby. Let's go.
The discharge criteria for us on the orthopedic unit is to, number one, make sure the patient is medically clear, meaning that they don't have any pending blood work or anything medically holding them back. Their blood pressure is good, vitals. They're not having any medical issues. Number two is making sure they can get up and ambulate And number 3, the main important thing is making sure that when they do discharge, they do have a safe place to go, whether that's home, a facility, rehab, whatever they may be. But the ones that don't, we try to encourage them and also make them feel like, hey, you're gonna go home, but you have to just meet these steps before you go. So we try to work with them just a little bit more, figure out some of their goals, and see can we accomplish those.